Hello, this is Lena, your compounding pharmacist at HB Pharmacy. One major problem that we have when taking our medication is the horrible flavoring, which is why at HB, for our compounded medications, we offer free flavoring. And today, our HB staff will be testing out the most popular flavoring options using these placebo medications, and they will try to guess which flavorings are in each of these placebo medications, and to actually see if they're palatable and likable.
This is definitely grape. It's actually funny because with all the Dimetap I used to have to take as a kid, I just hate grape flavoring. But this is not bad. This is definitely a grape pill.
This is actually pretty good. Flavor, I'm not 100% sure. I think it might be like cherry, but for medicine, it's actually pretty tasty. Grape.
Nailed it.
Also so terrible.
I think it's the raspberry. No? Is that the grape? Yeah. I'm all full of this.
I can't really taste anything. I think my mouth still has the other flavor. My bad.
You want water?
Yes, please.
Tutti Frutti. That has gotta be Tutti Frutti.
I'm gonna guess that this one is Tutti Frutti, and it's actually pretty tasty. This is the one. Like a passion fruit. It's the best one. That's the best one. Truly. It's really good. Can I have another of that?
If you want.
I'll like pretend I don't know.
I know what this is, but I think this one's the raspberry. No? Oh my god. It has a very strong taste, but I feel like I know the taste. I just...
The guava.
Guava? Okay.
This one's gross. Grape?
Guava.
Guava?
Guava.
Guava? Strawberry?
Close. Raspberry.
It's no good. Genuinely no good.
This one's a raspberry. Yeah? It tastes very good. I like the raspberry. I think probably best of all three so far.
Okay. Tastes like cherry? It's good.
Raspberry.
Raspberry? Do I leave like a Yelp review? I don't know.
I'm gonna guess grape, possibly.
I have no idea what that is. That one tastes like the guava. I mean, maybe that's Tutti Frutti. That's gotta be Tutti Frutti.
Okay. This tastes like Tutti Frutti, and it's actually pretty tasty. Cherry? That's not cherry?
This one tastes like licorice. I don't really like this one. What is it?
Tutti Frutti.
Tutti Frutti?
That's Tutti Frutti. That one's Tutti Frutti. That's for sure. They're not all Tutti Frutti. They're good though. It tastes pretty good.
This one's good. This is cherry. It's still good.
Tutti Frutti.
Okay, I like this one.
As you can see, not everyone liked all the flavors, which is actually very representative of our patient population as well. So the beauty of compounding is actually finding the flavor that actually agrees with you and putting that into your medication so it's easier for you to take your medicine. So if you have any questions about flavoring, if you have any kind of questions about tailoring your medications to your needs, including the flavoring, just give us a call at 201-997-2010 or just visit us at hbpharmacy.com.